Certainly. Here's a comprehensive overview of chest tubes, including their purpose, indications, insertion procedure, care, complications, and nursing considerations. Overview of chest tubes. Definition. A chest tube or thoracostomy tube is a flexible plastic tube inserted into the pleural space between the lungs and the chest wall. It is used to drain air, fluid, or blood from the pleural space and to help re-expand the lung. Indications for chest tube insertion: pneumothorax, accumulation of air in the pleural space causing lung collapse; hemothorax, accumulation of blood in the pleural space often due to trauma or surgery; pleural effusion, excess fluid in the pleural space which may occur due to heart failure, infection, or malignancy; empyema, collection of pus in the pleural space often due to infection; postoperative management, after thoracic surgery to prevent fluid accumulation and support lung expansion. Preparation is key. First, obtain informed consent. Make sure all sterile equipment is available. Then position the patient appropriately, usually sitting upright or at a 30 to 60 degree angle. Let's go over the procedure. Start with pre-medication by administering sedatives or analgesics as prescribed. Next, use an aseptic technique with sterile gloves and drapes. For site selection, typically use the 5th intercostal space at the anterior axillary line for fluid drainage, or the 2nd intercostal space for air. Administer local anesthesia at the insertion site. Make a small incision in the skin. Insert the chest tube using a blunt dissection method. Advance the tube into the pleural space, ensuring proper placement. Secure the tube by suturing it in place and attaching it to a drainage system. Finally, apply a sterile occlusive dressing around the site. Now let's discuss the types of drainage systems. The water seal drainage system utilizes water to create a one-way valve, allowing air or fluid to escape without returning. On the other hand, the dry suction drainage system uses a mechanical valve rather than water to prevent backflow, which allows for easier transport and management. Alright, let's talk about monitoring. It's crucial to assess respiratory status regularly. That means checking breath sounds, respiratory rate, and oxygen saturation. You should also keep an eye on the amount and characteristics of drainage, including its color and consistency. Oh, and don't forget to check for bubbles in the water seal chamber, as this can indicate an air leak. Finally, always observe for signs of infection at the insertion site. Now, moving on to maintaining the system. First, always keep the drainage system below the level of the chest. This is really important. Make sure all connections are secure and taped. And remember, do not clamp the tube unless instructed by a physician. Lastly, let's cover patient education. It's essential to explain the purpose of the chest tube and what the patient can expect. Also, instruct the patient to report any sudden changes in breathing or increased pain. This helps ensure they understand the importance of monitoring their own condition. Now, let's talk about some potential complications you need to be aware of. First, infection. There's always a risk at the insertion site, so you need to monitor for any signs of redness, swelling, or discharge. Next, pneumothorax. This can happen if the tube is not positioned correctly or becomes dislodged. Then there's subcutaneous emphysema. This occurs when air leaks into the subcutaneous tissue, and you might feel a crepitant sensation. Another potential issue is re-expansion pulmonary edema. This can occur if the lung is re-expanded too quickly. Lastly, tube dislodgement. This can lead to a pneumothorax and requires immediate action. Nursing considerations are essential in managing patients with chest tubes. First, positioning. Ensure the patient is comfortable and positioned to facilitate lung expansion. Pain management. Administer analgesics as needed to manage discomfort. Emotional support. Provide reassurance and support as chest tubes can be distressing for patients. And finally, documentation. Record the amount and characteristics of drainage and any changes in the patient's condition. Indications for removal of a chest tube include the resolution of the underlying condition, for example, pneumothorax or pleural effusion. Additionally, minimal or no drainage for a specified period and improved respiratory status are key indicators. The removal procedure involves several steps. First, gather supplies including a dressing, suture removal kit, and sterile gloves. Explain the procedure to the patient and place them in a comfortable position. Next, remove the sutures and gently withdraw the tube while having the patient perform the Valsalva maneuver, holding their breath. Apply an occlusive dressing over the insertion site. Finally, monitor for respiratory distress or complications post-removal. In conclusion, chest tubes are critical in managing various thoracic conditions. Proper insertion, maintenance, and monitoring are essential for patient safety and optimal outcomes. Nurses play a vital role in the care of patients with chest tubes, ensuring proper management and addressing any complications that arise. If you have any specific questions or need further details, feel free to ask.